Recently, I was looking at the studies for fenugreek to lower blood sugar. And now that's a plant, and the seeds and leaves are a lot of times used in Indian or South Asian cooking. And so it's easiest to find in South Asian specialty stores or grocery stores if you're living in the United States. And so it's been shown in vitro and animal studies to potentially lower blood glucose, and the mechanism is thought to be, it's been shown to lower blood glucose in human studies as well, but the mechanism is thought to be from decreasing gastric or prolonging gastric emptying time, as well as decreasing the absorption of glucose in the small intestine, and that impacts carbohydrate metabolism, as well as it could improve the activity of insulin and glycogen, as well as decreasing inflammatory cytokines. And so those are all the possible mechanisms of how it could work. Now, in human studies, there was a wide range of dosing that I saw. The most common was anywhere from 1 gram to 15 grams of fenugreek per day, either the seeds or the powder. And it was in divided doses because it is controlling your blood sugar. You'd want it to last all day. And so that was the dosing that I saw most commonly in the human studies. And definitely discuss it with your primary care provider first, though, because one of the side effects is it could make your blood sugar too low, and then you would have symptoms like passing out and things like that from too low blood sugar. Because the dosing range was so wide, it would be hard to know what would be the best dosing for you. You'd kind of have to experiment it, and so that's why you should discuss it with your primary care provider first. And also, there can be medication interactions with other medications you're on, especially blood thinners, but it could interact, with other medications. So definitely talk with your primary care provider first. But the studies are promising. A lot of them are from India because it's more commonly used there in food generally. But the studies are promising, so it's definitely something to think about if you are trying to lower your blood sugar.